In this lesson, we will be taking a look at the heart. We'll look mostly at the anatomy of the heart, just the physical structure. We'll talk about the walls of the heart itself. We'll look at blood flow through the heart, coronary circulation, and then we'll also be discussing heart attacks as well. So let's get started. With the heart, it is located in the center of your chest, of your thoracic cavity. It's about the size of your clenched fist. The weight of it is less than a pound, roughly. And that middle area of the chest where it's located is called the mediastinum. It is kind of nestled in between the lungs, sits on top of the diaphragm. And the position of the heart itself is the pointed apex of the heart, which we can see right here, is directed or tilted toward the left hip. You can see how the side kind of rests on top of the diaphragm. Right here is the diaphragm. And the base of the heart, which is here where all of the blood vessels leave the heart, that is kind of tilted towards the right shoulder. Okay, so again, it's the size of your fist, center of your chest, even though when we say the Pledge of Allegiance and we put our hand over our heart, you're supposed to put it over the left side of your chest. Your heart is actually in the center, and it's not on the left, but it is tilted toward the left. If we look at next, the walls of the heart, we can notice a few things. So here you have just a diagram of what part of the wall of the heart would look like. The heart is actually enclosed in a double-walled sac called the pericardium, and you can see that out here. It is, that itself has several layers to it. So there is the fibrous pericardium. You can see that right here. It's kind of whitish looking structure. And that just is going to help to both protect the heart and anchor it to the diaphragm and the sternum to kind of help hold it in place. Next, deep to the fibrous pericardium, so more inside of that layer, we have the serous pericardium. And that itself has two layers. It's pretty slippery, and it produces a fluid called serous fluid, and that's going to let the heart beat easily. It reduces friction in between those layers of the pericardium. The two layers of the serous pericardium include the parietal pericardium and the visceral pericardium. The parietal pericardium lines the interior of the fibrous pericardium, so they would kind of be attached to each other. You can see that here. So you have the fibrous pericardium, it is this thicker layer, and then this inner layer, which kind of continues here, is the parietal layer. So you can see that like thinner layer right underneath the fibrous pericardium right there. The visceral pericardium, or it's also called the epicardium, is going to cover the heart surface, and it's actually the first part of the wall of the heart. While we're looking at the pericardium, there can be a homeostatic imbalance called pericarditis. That is going to be when there's inflammation to the pericardium, and that can actually result in a decrease in serous fluid. And when that happens, the layers of the pericardium kind of stick together. When that happens and the heart is beating, it's going to form these painful adhesions, and it's also going to interfere with heart movement because it's going to be sticking instead of being able to beat kind of smoothly without friction inside of the pericardium. The wall of the heart itself is 3 layers. The outermost layer is the visceral pericardium that we just mentioned. Next is the myocardium, and that is the main part of the wall of the heart. That is our cardiac muscle that we have talked about before. Those cells are kind of twisted into bundles and kind of whirled into ring-like arrangements to allow the heart to have some of its functions of contracting. This is the layer of the heart that will actually contract. Then the inner lining of the heart, the part that's going, or heart wall that's going to line the chambers of the heart, is the endocardium. That will be continuous with the lining of the blood vessels leaving the heart or entering the heart. So that's kind of a continuous layer. It just makes for, smooth blood transitions into or out of the heart and then into or out of those vessels. The heart does have 4 chambers. The chambers are just hollow cavities. The upper chambers are each called an atrium, or plural would be atria. So there are 2. There's a right atrium and a left atrium. Those again are the upper chambers or the superior chambers. We can see them, these darker structures. Here would be the right atrium and the left atrium would be here. On the diagram, while I'm pointing that out, you can see that here it just says right atrium, but over here it says auricle of left atrium. That's the outer part of the structure of the atrium. Blood is going to enter the heart into each atria, each of the atria. So when blood is coming back from your body to the right side of the heart, it'll enter into the right atrium. And when blood is coming back to your heart on the left side from your lungs, then that blood will enter into the left atrium. There is a wall in between the right and left atrium that keeps them separated. It keeps the oxygen-poor blood in the right atrium from mixing with the oxygen-rich blood in the left atrium. And that wall is called the inner atrial septum. The other 2 chambers, or the inferior or bottom chambers of the heart, are called ventricles, and those are the discharging chambers. Those are going to pretty much be the main pumps of the heart. It's going to be what pumps the blood out of the heart somewhere. So your right ventricle would pump blood to your lungs, and your left ventricle would pump blood to the rest of your body. There is also a wall in between the right and the left ventricles, and that's called the interventricular septum. Again, that's going to keep the oxygen-poor blood on the right side of your heart in the right ventricle from mixing with the oxygen-rich blood in the left ventricle. Some issues that can happen with the wall in between the right and left side of your heart, we have listed here. So first we would have an atrial septal defect. That is when there's a hole in the septum in the wall in between the right and left atria. That would cause oxygen-rich blood on the left to mix with oxygen-poor blood on the right. So there would be blood, when the heart contracts and pumps, the blood's going to mix on both sides of the heart. Next would be a ventricular septal defect. Similar issue, but it's a hole in the wall in between the 2 ventricles. Again, it's going to allow oxygen-rich blood on the left of the heart to mix with oxygen-poor blood on the right side of the heart. Next, and the worst of the 3, is a complete atrioventricular canal defect, it's called. It's where there's essentially no septum in the middle of the heart to separate the right and left, and all blood from all 4 chambers mixes. So that would be the worst of the 3 that we see here. As far as circulation goes, the blood is going to be pumped by your heart. So for circulation, your heart, again, it's going to act as a double pump, essentially it's referred to as, because the heart is going to be responsible for pulmonary circulation and systemic circulation. With pulmonary, whenever we have that term, you should know that it means the lungs are involved. So pulmonary circulation is going to be the pumping of blood essentially from the right ventricle to the lungs and then coming back to the left atrium. For systemic circulation, if you think of systemic as in your body systems, this is going to be blood traveling from the left ventricle of the heart to the body, and then back to the right side of the heart and coming into the right atrium. When we look at blood flow through the heart that allows for both pulmonary and systemic circulation to happen, you're going to have blood, and we usually start with blood entering the right atrium. You could pick anywhere in the heart, and then just keep tracing blood until you got back to that same spot. But typically we just start with the right atrium. So blood would be entering the right atrium through the superior and inferior vena cava. And it would be oxygen poor blood that's coming back to the body. So that would be kind of the end of systemic circulation. From the right atrium, blood is going to go through the tricuspid valve and into the right ventricle. Once blood is in the right ventricle, and the ventricle will contract, blood is going to be pushed through a pulmonary valve. Technically, it's called the pulmonary semilunar valve. And I should point out another name for the tricuspid valve would be the right AV valve or right atrioventricular valve. So when the ventricles contract, blood will go from the right ventricle through the pulmonary valve into the pulmonary trunk. And then the pulmonary trunk is going to split into the right and left pulmonary arteries, where blood would then travel to the lungs. So here now we're getting into pulmonary circulation. So once blood is being pumped from the right ventricle to the lungs and then back to the left atrium, that is the pulmonary circuit or pulmonary circulation. Once blood has been oxygenated in the lungs, it's going to return to the left atrium through the pulmonary veins, and there are 4 of them, 2 coming from the right lung and 2 coming from the left lung. So once that blood enters the left atrium and the atrium will contract, blood is going to flow through the bicuspid valve or the mitral valve, and that is also referred to as the left AV valve or left atrioventricular valve. That blood then goes into the left ventricle. When the left ventricle contracts, blood is going to be pushed through the aortic valve, also called the aortic semilunar valve, into the aorta. And then from there, blood would travel to the body. It would go through all the from your aorta to the arteries, arterioles, capillaries, venules, and veins. And then it would be returning to the right atrium through the superior and inferior vena cava. So here we can see all of these structures. Okay, you are going to need to, on yours, label what structures are missing, I guess is what I should say. So the structures that you are labeling are going to be the structures that you'll need to know. You should be able to recognize these structures based on their location in the heart and not by the specific diagram, because diagrams can look a little different from one to the next. But you should still know the structures of the heart no matter what diagram you're looking at. So the way I'm going to go through these is the way that blood would flow through the heart. So we'll just kind of review what we did. Blood would enter the right atrium. So right here is the right atrium, through the superior vena cava and through the inferior vena cava. So you can kind of see where the blood would enter through here from the superior vena cava and right here from the inferior vena cava. Blood would be in the right atrium, and then it would be flowing through the tricuspid valve and into this chamber down here, which is the right ventricle. These structures down here are called chordae tendineae, and they help to just kind of anchor the flaps of the valve in place. The reason why it's called the tricuspid valve is you can see it's got 3 sets of chordae tendineae. It's got 3 flaps to its valve. When the right ventricle contracts, then blood gets pumped or pushed through the pulmonary valve here. It would go through the pulmonary trunk and then into the right pulmonary artery, which kind of curves around back here, and you can see part of it over here. And that would go to the right lung. And over here, the left pulmonary artery, where the blood would go to the left lung. Now, the lungs would essentially be where the writing is on each side. So they're directly on either side of the heart. So the right ventricle doesn't really need to pump blood that far because the lungs are literally right on either side of it. So you can see that the wall of the right atrium is not as thick as the wall of the left atrium. And it's for the reason that this chamber of the heart only pumps to the lungs, but this chamber of the heart has to pump blood out to the entire body. So once blood goes to your lungs, again, it's going to be oxygenated through the process of diffusion. Carbon dioxide will be dropped off to the lungs also through diffusion, so you can breathe that out. And then you're going to have blood coming through the right pulmonary veins and the left pulmonary veins and emptying into the left atrium. Then blood would be going through the mitral or bicuspid valve. You can see that it's got two sets of chordae tendineae, which is where it gets bicuspid. It's got two flaps to that valve. And then blood would come into the left ventricle. Again, you can see how much thicker the wall is there than on the right side of the heart. From the left ventricle, blood goes through the aortic valve, which is kind of tucked back here, and then into the aorta. So here we would have the ascending aorta, aortic arch, the thoracic aorta down here, and then the diaphragm would be right below this. So then through that, it would be the abdominal aorta, just to review some of the stuff we did with blood vessels. Let's see what else is on here that you're going to need to know. The muscles that kind of attach to the chordae tendineae are called papillary muscles. You need to know that. The myocardium is the muscle, the cardiac muscle in the wall of the heart. We have the interventricular septum that keeps the right ventricle and left ventricle separate. And I think that is all that you're going to need. I'm going to have you know on this diagram. So the extra ones that aren't on here that aren't on yours for you to label, that are on here, don't worry about those. Only worry about the ones that you needed to label yourself. Next, we're going to look at the valves of the heart. So there are, we said, 4 chambers to the heart. There are also 4 valves to the heart. There are atrioventricular valves, or AV valves, and they're going to be located between each of the atria and ventricles. So there's going to be a right AV valve and a left AV valve. The purpose of them is to prevent the backflow of blood into the atrium from the ventricle when the ventricle contracts. The right AV valve is called the tricuspid valve. Again, it's got 3 cusps or 3 flaps to it. Right here, you can see that kind of from a top view. So we've got 1, 2, 3 flaps on that. On the left side, it's the mitral valve or the bicuspid valve. You can see that here, and you can see the 2 flaps to that particular valve. Again, they are attached to the walls of the ventricles by structures called chordae tendineae that are pretty tough structures that, again, they're going to assist and make sure that the valve is open and closed at the right time. When the heart muscle is relaxed, blood is going to be filling its chambers and the flaps of those AV valves hang open. But when the ventricles contract, the pressure in the ventricles is going to increase, and that forces those flaps of the AV valves up and closed so that they would look like what you see in this picture here. And the chordae tendineae will help to anchor the flaps closed on that valve. That, again, is going to prevent blood from being pushed up back into the ventricles or back into the atrium from the ventricles when the ventricles contract to pump blood out of the heart. The other valves are semilunar valves, they're called. So they're between each of the ventricles and an artery that leaves the heart. You can see them highlighted right here. And they're going to prevent blood from flowing backwards from the artery back into the ventricles of the heart. On the right side of the heart, okay, we would have right here the pulmonary valve or the pulmonary semilunar valve. And on the left side, we would have the aortic valve or aortic semilunar valve. There are 3 little leaflets or flaps to both of these valves. And when the valves are closed, those flaps fit tightly together. When the ventricles contract and blood is forced through those valves, the leaflets or the little flaps will be pushed open against, kind of like trapdoor opening, against the walls of either the pulmonary trunk or of the aorta. When the ventricles relax so that they can fill with blood again, these flaps are kind of pulled backwards because if blood is going to flow backwards against it, it forces those flaps shut. And that keeps the valves closed so that blood doesn't go from the aorta or from the pulmonary trunk back into either ventricle. Some issues with heart valves include a heart murmur. That is where the valves of the heart don't close all the way. So there is some backflow of blood allowed. A normal heart sound would sound like a lubbed up sound, but if you were listening to somebody's heart that had a heart murmur, you would hear like a whooshing kind of sound in between each heartbeat that you heard, and that would be the backflow of blood from that valve. Another issue with valves is something called valvular stenosis, and that is when the valve flaps become stiff. It could be from bacterial infections of the endocardium, rheumatic fever caused by strep bacteria. It could be because the heart's required to pump harder than normal, and the valves can fail from the increased workload. A specific case is aortic stenosis or aortic valve stenosis, and that's where the aortic valve doesn't either open or close sufficiently, so blood can leak through that valve, causing pressure to build up in the heart from that blood kind of being trapped there from that valve not opening properly. They can do, depending on the age of the person, they can do an aortic valve replacement to help alleviate issues associated with that. Now, before we mentioned pulmonary circulation and systemic circulation, but we didn't talk about cardiac circulation. We did mention this when we did blood vessels, but we'll cover it specifically here. So for cardiac circulation, the heart itself needs a blood supply, because even though all 4 chambers of the heart have blood inside of it, that blood is not able to nourish the myocardium or nourish the muscle of the heart. So it needs coronary arteries that branch off from the base of the aorta. You can see that here. Okay. And those are going to carry blood to the heart muscle itself. And then the myocardium is drained by cardiac veins that'll empty into the coronary sinus on the back side of the heart. And then from there, that blood would go into the right atrium. So the first place, again, the heart is really pumping oxygen-rich blood to is itself. Some issues with cardiac circulation include something called angina pectoris, or sometimes it's just called angina. It is like a crushing chest pain that is caused by the myocardium or the heart muscle not getting an adequate supply of blood. And then a myocardial infarction is the technical name for a heart attack, or what we sometimes refer to as a coronary. And it's going to occur when the myocardium, or again, the heart muscle, the cardiac muscle, is deprived of oxygen because of an issue with a coronary vessel. So there could be a plaque that built up inside of a coronary artery that's blocking blood flow to the heart. It could be a blood clot that traveled there from somewhere else, but it's blocking part of the heart muscle from receiving oxygen-rich blood. And then just kind of finishing up and adding on to that with a myocardial infarction, it's also referred to as an MI. Again, it can be caused by plaque buildup in a coronary artery that occludes or blocks blood flow to the heart muscle, or it can even be caused by a muscle spasm in a coronary artery. Symptoms of an MI would include angina, chest tightness or just kind of discomfort in your chest, even a possible like feeling of that you have heartburn. You could have shortness of breath at rest, discomfort in your upper body, specifically on the left side. It can be either side or both, but usually the left side is kind of a more telltale sign. It's a more common symptom. So like pain in your left arm, for example, that can be a sign of a heart attack. Jaw pain, having cold sweats, feeling unusually tired, like I'm sure we all feel tired all the time, but feeling way more tired than normal. Maybe you feel dizzy, you might be nauseous or even vomit, or any sudden new symptom or sudden change in a symptom. So maybe you kind of have been having some chest tightness for a while, a couple of days, but then all of a sudden it becomes a lot worse. Okay, those are all signs or symptoms of an MI. What to do in this case is to call 911 right away. If it is you or whoever you're with, you should still call 911 so that they can at least, even if let's say you have to take someone to the hospital who is having heart attack symptoms, they can alert the hospital that you would be coming, or if there's no way to get somebody there, then an ambulance can take that person to the hospital. If aspirin is available, you should chew and swallow a 325 milligram aspirin. That is because aspirin is a blood thinner, and you should chew and swallow it to get it dissolved and into your bloodstream faster. Because it's a blood thinner, if there's not a 100% occlusion or blockage in that vessel, it could thin the blood enough so that there's some blood flow past the blockage, and that can help to limit the severity of a heart attack. And then you should get to the hospital either via ambulance or have someone else take you. You should never drive yourself if you are having any of these symptoms. It seems kind of common sense, but people have done it, so just don't do that if it's ever you. Make sure you have a ride of some sort. Treatments for an MI are some we have listed here. Cardiac catheterization. They can use that to find the blockage, like find where the blockage is. A balloon angioplasty and a stent placement, that can be done in conjunction with cardiac cath, and bypass surgery. So we will, in our next class, we will be watching all of these procedures. So we'll talk more about them in our next class.